Students, today we'll study about one more disease, that is typhoid. Typhoid is mainly caused by a bacteria called Salmonella typhi. This is the diagram of Salmonella typhi, and this is present in the lumen of intestine. Hence, unlike amoebiasis and ascariasis, typhoid is also an intestinal disease. The outer ring or the outermost membrane, it is called as capsule. There is one more covering that is present below capsule, it is called as cell wall, and the hair-like structures that are present is called as flagella, which is a locomotory organelle that helps in the movement and locomotion. In addition to that, there are antigens such as K antigen or V antigen that is present in capsule, O antigen, it is present in the cell wall, and H antigen, it is present in the flagella. The pathogenicity or the virulence of the bacteria is due to the O antigen that is present in the cell wall. The bacteria, it is red color, and the shape of the bacteria is rod shaped. The Salmonella typhi, it is a gram-negative bacteria. The difference between gram-positive and gram-negative bacteria is, in gram-positive bacteria, the cell wall is very thick and is made up of protein called peptidoglycan, whereas in gram-negative bacteria, the cell wall is thin and is made up of protein called peptidoglycan. In gram-positive bacteria, lipid layer is absent, and in gram-negative bacteria, lipid layer is present. Salmonella typhi is a gram-negative bacteria, and the cell wall of Salmonella typhi is unable to retain the crystal's violet stain, and hence it is colored by safranin only. This is about the structure of Salmonella typhi. Then comes the mode of transmission, how it is transmitted from infected person to healthy person. When an infected person passes urine or stools, and houseflies and cockroaches sit on the stools, and then they sit on the food that is kept open or water that is kept open, it is transmitted. And when a person eats contaminated food or water, the typhoid is transmitted from infected person to healthy person. Poor hygiene means the person when passes stool and urine and does not wash his hands with soap and water, that is called as poor hygiene. Then comes the signs and symptoms. The symptoms that are seen in typhoid are prolonged fever, which is the characteristic feature of typhoid. Then rose-colored rashes are seen on the body. A white coat is formed on the tongue. There is loss of appetite. Loss of appetite is the person doesn't feel like eating. Another symptoms such as cough, headache, nausea, fatigue can also be seen. Nausea means a person feels like vomiting but does not vomit. Fatigue means extreme tiredness. Abdominal pains and diarrhea can also be seen in typhoid. If it is not treated in time, another symptoms such as breathlessness and hemorrhage can be seen. Hemorrhage is internal bleeding or escape of blood from ruptured blood vessel. Then comes diagnosis. There is a test which is conducted to confirm the disease typhoid, and the name of the test is Vidal test. This test is performed, and then we come to know whether the person is having typhoid or not. Then treatment. Treatment includes surgical removal of gallbladder. Why this has to be removed? Because these bacteria, they may accumulate in the gallbladder, due to which it has to be removed. Another treatment includes antibiotics such as chloromycetin, azithromycin and ciprofloxacin. Then comes preventive measures. In preventive measures, the important things that can be done is to maintain personal hygiene. That means Whenever we pass urine or stool, we must wash our hands with soap and water. Then we should not eat the food that is kept open. And another preventive measure is vaccines are available, so we can take vaccines to protect ourselves from typhoid. There are two vaccines, that is oral and injectable. Oral vaccine, which is taken through mouth. Injectable, it is given in the form of injection. The oral vaccine that is available is Typhoid 21A, which is also called as Typhoid V, and the injectable vaccine that is available is TPV, that is Typhoid Polysaccharide Vaccine, which is also called as Typherix. Thank you.